All characters appearing in this work are fictional. Any resemblance to real persons is unintentional. This video features the Integrative Screener version 2.0. The Integrative Screener version 3.0 is the most current version and is available for use. Some features of version 2.0, portrayed in this video, have changed. Please refer to the brief and full user guides for further specifics, available on our website, communitycollaboration.umbc.edu, or contact our center.
Welcome. I'm Carlo Di Clemente, the Director of the Center for Community Collaboration at the University of Maryland, Baltimore County. And I want to just introduce to you this No Wrong Door Integrative Screener. And these videos will really try and help you to learn how to do this and how to administer, score, and use the Integrative Screener. This Integrative Screener, the first video really will take you through the administration, the screening and scoring. The second video will look at a general introduction to brief interventions. And the third interview will be really how to use the Integrative Screener in terms of the brief intervention and referrals. So we hope to kind of cover the whole basis of the Integrative Screener in this video series. The Center for Community Collaboration, you can reach us at this address, the phone numbers, and we also have a website. So feel free to look on the website and to contact us if you have needs and clarifications around these videos. Let me give you a little overview of the Integrative Screener. Most of you know why you need an Integrative Screener. Clients who come in don't just have one problem, they present with multiple problems. And there's an overlap in lots of the different problems that clients present with, whether you come in with mental health or substance abuse or HIV or primary care. So the idea of the Integrative Screener is to try and see, can we promote integrative care by using integrated screening? So what we're trying to do is really improve the integration of care across multiple health domains. I mean, there's mental health treatment, substance use treatment, primary care services, sexual health, and then HIV and other infectious disease services. If we look at the risk profile of an individual, then we can actually access appropriate treatment for that individual and develop treatment plans that are appropriate. And we can collaborate better with other community agencies and improve the continuity of care. So the No Wrong Door Screener was developed in collaboration with clients, providers, and the No Wrong Door partners. And it really helps us to identify risks and facilitate appropriate referrals. It is designed to be comprehensive. So what we've done is draw on validated, trusted, highly utilized instruments and resources and try to screen across a number of health domains that seem most critical for your population. The current health domains that we actually screen for include physical health and primary care, mental health, and under mental health we talk a little bit about depression, anxiety, trauma, and suicidality. So there are screens for all of those. Under substance use, we actually look for both tobacco and alcohol, but also illegal drugs and non-prescription use of prescription medications. When we go to sexual health and infectious disease, we look at both the connection between substance abuse and sexual health and risk, as well as looking at HIV testing, looking at infectious disease testing, and looking at HIV and infectious disease care. There are also some additional modules that if you're interested in, you could actually use. Those are one on stigma, because we believe stigma may interfere with treatment, one on serious psychopathology, and one on gambling, because more and more we need to be looking at gambling as one of the addictive behaviors that our clients use. The screener is also designed to be flexible. So we have different versions of it so that you can use it, the provider can use it as an interview, the client can use it as self-report. And what we think is the best way to use it is using it as an electronic form. So we have it on a computer, and you can just click on the answers as you go through the computer, and it will provide you with a feedback page that will actually help you do the last page of it, as we'll talk about in a minute. So it can be used at intake, but it also can be used at multiple points during treatment to track client progress or to identify new risks that come up along the way. What you see is really that there is a provider format that's shaded, so it actually indicates severity of problem as you kind of look at the darker shading. There's also client self-report that's unshaded, and it's unshaded on the computer or on the paper version so that the client can do it and doesn't look at any of the shading. The other thing that is really unique about this integrative screener is the last page. So once you go through the screener, you can identify risk and across a variety of areas. But you don't just go from risk to referral. What we'd like to happen with this screener is that you talk a little bit about each of those areas of risk and then ask about readiness. So how ready are the people to take action to do something about this particular risk area? And only after you do that do you talk about whether they will agree to a referral and what kind of referral you would do and whether you've made a referral. So that's the idea behind it, is that we assess risk, but we also assess readiness in trying to use this integrative screener to help with planning, treatment planning, and continuity of care.